No matter which techniques you use, your chances of success depreciate dramatically if you don't know why you're doing what you're doing. Even the best technique is doomed to fail if you're treating based on an incorrect diagnosis. How do you get to the right diagnosis? It all starts with proper evaluation, of course. Once you've identified the patient's presenting complaint, appropriate assessment is vital to determining the true source of dysfunction so you can successfully treat it. Hi, I'm Peter Crownfield, Executive Editor of Dynamic Chiropractic. Let's learn more about evaluation strategies from Dr. Perry Nickleston, a chiropractor who practices in Ramsey, New Jersey, and utilizes what he calls the core 4 principles of evaluation. Dr. Nickleston, thanks for being with us today. So, in your opinion, what's the key to proper assessment?
Thank you, Peter. One of the things I'm going to talk about today is not so much a chiropractic methodology or technique as opposed to a principle of evaluation. At my Stop Chasing Pain clinic here in New Jersey, we have a specific core 4 program of evaluating people when they come in to see us to delineate between site and source of dysfunction. So, for an example, if someone has an elbow problem, lateral epicondylitis, which is typically difficult to treat, we go through our core 4 evaluation, and that's looking at joint structure, muscle, fascia, and movement. So for this particular condition, I would look at the cervical spine, thoracic spine, SC joint, AC joint, first rib, glenohumeral joint, elbow joint, wrist joint, all the way down to the lumbar spine and bilateral hip joints. Then we're going to move on to common muscles that can restrict movement and motion and also refer trigger points to the elbow. So we'll start all the way up in the chain looking at the scalenes and SCM, pec major, pec minor, supraspinatus, infraspinatus, subscapularis, distal tricep, as well as brachioradialis, and work our way down into the extensors. Then we're going to look at the fascial connection, which I've seen as a big component of most things that I see. We look at the superficial and deep front and back lines of fascia that goes from the chest and the upper back all the way down in the arm, and we look for restrictions or snags. I also investigate down into the thoracolumbar fascia as how it bleeds into the thick attachments of the glute structures as well. Then we're going to look at the kinetic chain of movement, and I typically see with an elbow problem a lack of stability in the shoulder blade, so people have a sloppy shoulder blade and they move too much in the arm and then they bleed too much down into here with movement and motion, and then they get tendonitis from an overuse. I see a lack of extension in the thoracic spine and a lack of symmetrical rotation in the thoracic spine. So always evaluate for that, and typically I'll see an opposite side hip issue with either mobility or stability or a little bit of both. Anterior head carriage and some weakness in the neck flexors. So the principal evaluation is just to look a little bit more globally as opposed to centrally when somebody has a site of pain. Look for the overall source and stop chasing pain, and hopefully this will take you in a nice direction to helping your clients even more. Thank you so very much for having me come on, Peter, and enjoy the Parker seminars.
That's excellent information, Dr. Nickleston. For more information on this and other topics relevant to your practice, read Dr. Nickleston's columns in Dynamic Chiropractic and on our website, dynamicchiropractic.com.